Okay, good afternoon, good morning, everyone, and thanks for attending this webinar on accountability, inclusion, and protection. Just before I introduce the webinar, I'm just double checking that you can hear me well. Masumi, is it all fine?
Yes, we can hear you very well.
Okay, good. Okay, so thanks and welcome everyone. So first of all, let me introduce the facilitators. So we have Masumi with us, who is program specialist, GBV, and Ahmed Ghanem, who is also program specialist from the disability section. And I'm Charles Antoine, senior advisor on community engagement and accountability. So I'll give a brief introduction and hand over to colleagues. But first of all, maybe covering a few practicalities. We are expecting a few more participants. Will be quite a significant group. So we will not introduce everyone, that would take too long, but please, towards the end, when we have a Q&A session, if you happen to speak, obviously introduce yourself and where you're coming from. We will record, as you may have noticed, we will record this webinar and make sure that it is made available to all those who registered, and we'll send the link together with the resources once completed. As I said, we'll have a Q&A session, probably about 20-25 minutes in the end. So you can use the Q&A box. I'm sure most of you by now are familiar with these different tools. If you have any particular question, you can type it or just raise your hand, and we'll give you the floor when we have that session. We will also we'll be monitoring the chat box as well. But please ask questions in the Q&A part. That's going to be easier for us. And also to break a bit the flow, we will have a number of very simple polls to take the temperature of the group and ask you a few questions so that you can also participate in this webinar. And Masumi will give a few more details, practical details on how this is going to work in a few seconds. I think that's all the practical aspects I wanted to cover. And just to introduce the theme now, if we can move to the next slide, please. You will have received the invitation, and I will just go through the overview of what we will cover. Ahmed and Masumi will be presenting a number of slides. Basically, first, understanding the role of cross-cutting issues and how to integrate them in UNICEF clusters, UNICEF-led clusters and AOR. That's something we've been working on over the last few years, and really a commitment from our side to make sure that cross-cutting issues work together and make your life simpler at country level. And we'll be focusing particularly on how to best achieve that, looking at the humanitarian program cycles. So focusing in particular at the HNOS, HRP, and also resource mobilization. So we'll be looking at these three areas. And as I said before, space for question and answers, but also some discussion or comments towards the end. Without further ado, I will hand over to Masumi to give you some introductions. Thanks.
Thank you so much, Charles Antoine, and good afternoon, good morning, good evening, everyone. Thank you so much for joining us. We want to start easy, like Mentimeter, to check, to really start our discussion on what is your current practice on integrating cross-cutting issue into the HNO and HRP. I know many of you are also not from cluster, so in this case, maybe a different process, but it'd be great if you can go to either menti.com and use code 3644327, or use this link at the chat box, and then you can go directly to the Mentimeters. I will show you the Mentimeter now, the slide. Yeah, we have 10 people already in here. I'll wait a little bit for more people to join. So the easiest way is that you can just click the link from the chat box. Otherwise, you can put www.menti.com and then put the code 3644327. Okay, great. So first question is the current practice in needs identification. So needs assessment, needs data analysis, and a needs identification finally for HNO. What is your current practice? So we have 6 questions. So please, this is how to say the, or like rank the scale. So if you think you're not doing it at all, then strongly disagree, and you're doing very much, then strongly agree. For example, we have a specific plan in your country to include vulnerable population like children, women, and persons with disability in need identification. And if you're doing it, you can click strongly agree. Or maybe you're doing, but not so much sure, then maybe you can click 3. So please take some time to do this survey. I don't see anyone. Okay, 3 people. Okay, we only have 10 people. Okay, we'll wait maybe 30 more seconds to go, and then we have 2 more questions. So now the practice for HRP, and then finally how much you work with the cross-cutting specialists like AP specialist, disability specialist, GBB specialist. And it's just nothing wrong or good. It's just we want to know what is your current practices so that we know that whom we are talking to. But it's great in general, like, yeah, we do have a very good engagement already for needs assessment. Okay, let's close and then go to next. Thank you. So next question is the same thing. Now it's for the HRP. I know maybe the HRP process hasn't started, so it's more like if you are planning to, and if some countries are already starting the practices, maybe you can you can think as a kind of present. That's great. Quite a few people selecting that compliant and feedback mechanism, right, to making sure that vulnerable population access to it. That's a very good start. And yeah, many like 3.4, 3.3 people are the participants are thinking are like disability inclusion and risk mitigations. And I think it's really great. Let's wait for maybe 10 more seconds before we close and then ask next questions. Great. It seems like most of the countries are doing something already. The plans are there. That's really great. Excellent. So now I'm going to ask last question. So are you currently working with any of these cross-cutting specialists for HPC 2021? If you are not from clusters, maybe you can think of like hack or something else. And it can be our specialist in your country or specialist at region or at the global level. So if you are actually working with, let's say, AP specialists in country or in region or in a global level, you can put, yes, exactly. So 5 people already working, excellent. Right. So it's about half of the, I think half of you are working with disability, and maybe a bit more than half for AP disability. Quite a lot of people working with protections and gender, very little for localization, maybe disabilities as well, could be. Okay, excellent. So I'll close the voting for now. Thank you so much. So actually you're then in the right place, because we are hoping this webinar is our first engagement, not the last engagement. So it's great to know, but it's already good, very encouraging. For example, our, let's say like 60% of you are already working with AP, GBB, and protection. So already you're at the very good stage. So let's now go to the, really the focus of the webinar. So this webinar is really, first of all, cross-cutting issues really focus on particular areas of concern to humanitarian response, and also address individual groups or general vulnerability issues. So that's why, for example, I mainly work for GBB, and then there's Ahmed who work mainly on disabilities. Charles Antoine, our AAP, that's more broader issues. And there's also gender specialists, child protection specialists, and so on. This webinar, but does not cover all the cross-cutting issues. Our main focus will be AAP, disability, and protection, especially GBB risk mitigation. It is because we have been working at least 2 years together to find our common approach among ourselves. But we did work with the localization specialist, child safeguarding specialist, child participation specialist, and gender specialist, also to really identify the common way, the common approach that we are taking, so that it's, I think, easier for everyone who is actually integrating cross-cutting issue to understand what are the common approach and what are some of the specific issue. And this really presentation webinar is focusing on a common approach, especially for HNO and HRP. And it will not replace the needs of the maybe additional training or reading for the disabilities, for example, or AAP. But we really want to make sure that here we will want to present this very, very core, a common part that's across the different cross-cutting issues. So before we start anything, I want to start why we integrate cross-cutting issues are critical in COVID-19 context. For example, the secondary effect of COVID-19 increases burden of women and girls at home, community, and work. I think all of you must have heard the increase to cases of gender-based violence is reported in everywhere, but also women are 70% of frontline workers are women. So it's extreme, their kind of burdens have been really increasing. And also persons with disability has challenges receiving necessary services or accessing to modified humanitarian response services. I mean, this is just a few examples. And they also are restriction of movement globally and domestically, making it very difficult. For example, for UNICEF and INGOs, it's really hard to move like before. And also primary data collection this year will be very much limited. I understand some of countries are not going to do MSNA. Some country will do it, but more remote data collection. So it's a bit different from the usual years. And also information collections that since we can't move, we need to, like we depend a lot in ICT skills, the technologies, but it again removes maybe a certain population group, for example, persons with disability or women, children, from accessing our consultation or accessing information provisions. So really cross-cutting issues can help. Hopefully we can, and then we are trying to provide, we will present some of the good examples, but cross-cutting, integrating cross-cutting issues that maybe we can address some of the issue. For example, GBB risks, because we know that risks are increased, so our GBB risk needs to be identified across the sectors. And also traditional services, traditional entry point has been kind of overwhelmed or closed. So there is a more possibility, for example, a survivor seeks support from nutrition or education or hygiene promoters. So we need to be ready more than ever. And also needs of persons with disability need to be integrated well, again, because of the modification of services, they may not be able to access to services anymore. Again, for the restriction of movement, I think we all working more with local organizations, and they are the ones who can really provide our information, provide our good ideas on how to do the modifications. And again, local actors and community-based organization can play more significant role ever because really of the restriction of movement. So it is also it is a challenging situation, but it is also a very opportune moment. So also integration of cross-cutting issue is just for good programming and to reach to your objective. So it's not the burden, it's not the favor to anyone. So I just wanted to give this example by using access to toilet. For example, I mean, it's supposed to be everyone, children, women, men, persons with disability should be able to access to toilet. But when there is no privacy, or if it's not accessible, like our visually or physical disabilities, it could be also our girls can be harassed on the way to latrine or while waiting for latrines, or it's not safe at the night time. And there's a lot of taboos. For example, it's very popular for women shouldn't be seen when they're going to go toilet. And these kind of things becomes a barriers. And then because of the barriers, they will not go to the latrines, but they might resort to open defecation because it's, for them, maybe it's more private, close to home. But then it increases the problem for wash, but it also increases the risks for those people who opt for open defecation because of the barriers. And normally it works very well if there's a feedback mechanism from the people, so that these barriers are identified and barriers could have been addressed before it's emerged. But also sometimes feedback mechanism is not accessible to all. I just explained our example of the information like digital technologies, and the children, women, and persons with disabilities especially are likely to be excluded from the feedback and complaint mechanism. In this case, their opinions are not included. So it's kind of a vicious cycle. But really considering cross-cutting issues, we can remove this. And hopefully we can create this like a happy cycles of people accessing the services, and then you reach to your cluster objective. And then everyone can provide their feedback to the systems, and then their feedbacks are included into the services. So it is really just a good programming. So UNICEF has been making a lot of commitment for the accountability, inclusion, and protection. Some of the example is, for example, UNICEF ED4 made a commitment in the Oslo conference last year to make at least 10 HRPs for 2020, include GBB risk mitigations and the risk analysis and mitigations. And also for disability, the UNICEF leads the interagency commitment to ensure that at the end of 2020, 2020, at least 70% of HNO HRP use a common recognized methodologies and routinely disaggregated data on disabilities. And of course, there's a different commitment for ISC, including centrality of protections and so on. And the UNICEF also does have a strong commitment to AAP, and we lead a lot of work. So that's the UNICEF's commitment, and we will also explain shortly how we are doing in terms of our commitment. So based on this institutional commitment, UNICEF-led clusters and AOR, so child protection, education, nutrition, and WASH, are committing to place affected population at the center of our actions. So center of the needs analysis, center of the response, and center of implementations, and also make sure to support local organizations and also to identify and address different needs, barriers, risks, and capacity of different population groups. And finally, really make special efforts to support the affected populations by making sure they participate in decisions throughout the HPC process. We will focus today on HNO and HRP, but really the inclusion is really throughout the HPC process. And we've been also reviewing different criteria and different principles among different cross-cutting issues. And we found that these are kind of 3 key common principles that different cross-cutting issues are really asking. One is really do no harm. So reduce risks and do no harm. So it's really the biggest part. So different population group and subgroup have a different risks. And we really need to understand what are their risks and why they face these risks, and then how we can address that. And second, it's really the foundations of all the cross-cutting issue is the participations. And when we say participation, we need to pay really our specific attention to those who are likely to be excluded, like children, like women, like persons with disabilities. And finally, it's really safe access to different services and different population group. Again, it's safety, the barriers for women and barriers for boys are very different. Barriers for girls and barriers for men are different, but we really need to understand barriers so that they can access to services, and also you can achieve your goals. This is also a summary for HNO HRP review, GBB AAP disability. We have done our common analysis in 2019, and this year bit separately. So for AAP, already 50% of 2019 HNOs had our AAP covered, at least in the part 1. The sector part for the cluster specific HNO and HRP, it's become a little lower. So only 22% of the HRP has some AAP component. For GBB, we have done these comparisons for 2019 and 2020. So for educations, 13 HNOs in 2019 and 9 HNOs in 2020 has a GBB risk analysis, and the 15 HRPs and 8 HRP in 2019 and 2020. For nutrition cluster, 5, and in 2020 it's 4, and for HRP it's 4 and then 3 HRP. For WASH cluster, it's same as the education cluster, the 13 HNO in 2019 and 9 HNOs in 2020 had some kind of GBB risk analysis, and also respond GBB risk mitigation measures in 10 HRP in 2019 and 11 HRP in 2020. So we are kind of on the right track, but we still haven't reached to the, for example, ED4's commitment for all cluster in 10 countries. So disabilities compared to 2018 review, 2020 HNO and HLP showed substantial progress in disability inclusions. But in 2020, only 31% of HNOs reflect consultation with the persons with disabilities or organization with disability. And only 56% of HRP mentioned disability in the result framework. And also reference to the disability in the sectors, education 11, protection 11, WASH 7, and nutrition. So in summary, we are in the right track, but there are still areas that we can strengthen. And the good news is that we can really learn from each other. So I'm not going to explain all, but again, the big strength is that there is recognitions, more and more recognitions, and the quality of integration has been really strong, has been kind of improved over the last 2-3 years. But there are still some weakness in the HNOs. For example, many sectors or general parts done barrier analysis, but really focusing on like refugees, IDP, and not really disaggregated by age, gender, and disabilities, which makes it very difficult to understand what are, for example, specific barriers for a refugee boy to accessing to educations. So that's some area that we could really strengthen. And these people have been, I think there have been a lot of efforts to reach out to vulnerable populations, but still it's not systematic way. So the many of the data are really, for example, are sometimes depending on the MSNA or household survey, and little maybe participation from the affected population. Same thing for HRP. There's a lot of increased knowledge and increased efforts. Very good example for integration in HRP. But there are general challenges for discrepancies between the needs identified and then the response strategies. So sometimes needs identification is fantastic, but the response strategies are not responding to the needs or barriers that you identified. And the other thing is the same as the HNO. That's really the participation and reflection of the vulnerable population into HRP. Now over to you, Charles Antoine, to.
Thank you very much, Masumi. All very interesting as usual. And let's continue now going a little bit deeper into HNOs and HRPs. So I'll hand over to Ahmed for the continuation of the presentation.
Thank you, Charles. Thank you, Masumi, for your opinion. I will remind all of our attendants, if you can send your question on Tide question and answer, it will be very helpful. Thank you, Mahdi, and thank you for your question. So how can we achieve this commitment toward accountability, inclusion, and protection? I think we need first to understand that this COVID-19, the situation of developing HNO, HRP during COVID-19 have a specific situation. What we could expect, we expect, of course, that we will have a strong link with global humanitarian response plan that have been developed for COVID, and GHO that will be developed for COVID. We should also understand that related to COVID, we need to ensure that we are benefit from the global health GHRP analysis I'm conducting during the last months to feed into our national HBC cycle. Also, we should understand that there will be an increased focus on risk analysis and projections of the COVID-19 on our situation. We anticipate that there will be more focus on secondary data and expert judgment in comparison to primary data due to the situation of data collection problem that we are facing under COVID-19. We will also encourage and anticipate that there will be a strong partnership with local women organization of persons with disability, and other local actors to collect descriptive and qualitative data in order to design a responsive strategy. So we will depend on the local community and localization to get a good picture of what is going on. Also, there will be a support to efficiency and the comprehension approach through emphasis on the joint intersectoral analysis, multi-sectoral response, and localization, linkage to development plan. All that we can expect that this HNO HRP cycle will different due to COVID in this way. So next, please. So if we said that if we have a common approach, if we as a cross-cutting issue and specifically for accountability, for inclusion, for protection and GBV, what kind of common approach we can follow in need assessment and analysis for HNO? If we can give you a 3 common approach, very important one, we will highlight these 3 one. First of all, we need to work with local actors, specifically local women organization and organization of persons with disability. We need to identify them. We need to support their participation in need assessment and need analysis and the validation also finding some time. Including boys, girls, women, and including all persons with disability. It will be very important at this stage to understand what is the situation. Also conducting barrier analysis and identify key barriers in front of these groups, women, girls, boys, at different age, person facing different kind of disability. It's not anymore enough to say we are having a vulnerable group or this is a list of vulnerable group. We should go a further one step to have a more barrier analysis to understand what is the key barrier that is fitting them and how we can do that through an inclusive feedback mechanism to consultate with all affected population. Also, identify risk and different coping mechanism. Most of the time we have seen during our review to previous HNO HRP that most of the time in HNO there were usually identifying the risk and coping mechanism to general population without considering that this vulnerable group have their own way in coping mechanism. So understanding this specific coping mechanism, this is specific risk that is related to gender, related to age, related to disability, it's very important at this stage and to understand also how they cope with the shock of the humanitarian situation. Next, please. If we have an analysis, for example, we have GIF, of course, one of the analysis framework that we consider that will be either you already are heavily working with it or you will heavily work with it. We need to consider integrating gender, accountability, inclusion, disability within this framework. We are not asking you to have a parallel process. We are asking you to consider in every stage that you are considering this topic. For example, at plan and design stage, you should integrate questions related to GBV, disability, and accountability to affected population in the joint analysis plan. And this question will help you to ensure that your planning, inform your planning decision in the future. When we are moving to collect data, we need to understand that primary data collection, if we will do it, should include disaggregated data related to children, women, and persons with disability. At least if you will be not able to have quantitative data, to have some qualitative data by consulting these groups, or ensure that you have access to other sector that may have more focus on this group like protection sector. When you are doing the joint analysis, it's also very important to involve disability and gender and GBV specialists for data interpretation. Most of the time we see that the country has the data, they able to reach it as a secondary data or primary data, but when it comes to interpretation of this data and understanding it, sometimes we have a limitation. Invite this specialist to help you in the interpretation, and one of the highest level of specialists in this topic, the people themselves, of course, the affected population themselves. Intersectional analysis and understanding also the diversity and how this topic is interacting together. How, for example, a girl with disability is facing risk. This is kind of cross-cutting between gender, age, and disability in this situation. And the most important thing, when you are doing analysis, don't just create a list of vulnerable groups. We have seen that a lot, and most of the time it's not lead to any change on the ground. When we yes, acknowledge them, it's very important, and it's a very a high step to the future, but it's not enough. Without understanding and analysis what kind of risk they are facing, it will be very difficult to develop an response plan, as we will see. Validation of the data at the end, we should work with local organization as we have thus to just validate all the data that we will have. Next, please. For example, working with local organization, it happened in Somalia in 2019. There was the global CBE children protection area of interest have done a need identification and analysis framework. Team supported Somalia to do this with the local organization. National partner was actively participate on the need analysis, prioritization, validation of the result, and also how this was an added value to existing operation, and also to measure all the child protection indicator. This will have, of course, required several sessions of joint analysis interpretation session, and of course to work with these groups of local organization to prioritize the location where the most severe children protection is needed. And it actually was very insightful exercise. Next, please. We have said a lot and we repeated, barrier analysis is very important. Barrier analysis is very important. And how we can do that, I think this is an overall framework to do that. It's depend on that. We need to understand 4 things. What is happening? First, at the right side, we need to understand what kind of barriers. And barriers is not only physical barriers like distance or infrastructure, also institutional barriers like availability of the service, communication barriers, as we, for example, for COVID-19 response, inability of some person's ability to reach to information, attitude and perception, how stigma, fear, or discrimination is preventing and forming barriers. This will actually affect how the services is organized, how the availability of the service, acceptability of the service, accessibility of the service, and as we said, the accessibility have different type: physical accessibility, financial accessibility, and so on, and the quality of the services. So understanding what kind of barriers, asking ourselves what kind of barriers based on these 4 types, understanding to which extent the service that we are either existing on the community or we are planning to provide having availability, accessibility and acceptability and quality. Understanding also how the intersectionality, how the diversity, how age, gender, disability, poverty, ethnicity, situation of the person itself, it's refugee, the displaced person, all that is interacting with the barriers to increase or decrease the barriers. Some barriers will be faced only by persons with disability. Some barriers will be faced only by children. Also, all that we need to understand how that will heighten the risk that is faced by this group. Abuse, invisibility, injury or poor health, loss of livelihood, exclusion of services, violence, including GBV, of course, separation of family. All that is the risk that is heightened specifically for this group. Of course, this is not a comprehensive framework, but is some sort of ideas about how we can think about the barrier analysis. Next, please. So what kind of examples of barriers and risk it have been identified already in HNO? Actually, last year, there was a very high level improved in HNO in the situation of the barriers analysis and risk identification. And we have identified several examples. And here some examples. For example, we identified distance and location to facilitation and service. There are lack of financial resources. And some HNO have highlighted, for example, violence at schools. Without going in details, we can see that some of this is very clear. For example, when we said affordability of the service, extra cost, for example, it's some extent or design of facility, either universal design or accessibility. Some of them is clear, and some of them is just one word or one sentences without further analysis. For example, when you are saying lack of financial resources, it's not clear what is the problem, what is the barriers. Is it only for poor or for everyone? Is it only for persons with disability, for example, or for everyone? Sometimes we need to go further and stop to some extent using cliche and start to give more analysis to the topic. Next, please. So we will have some good example from WASH from Syria last year, HNO Syria last year. For example, they have 3 stages of including GBV and to some extent analysis of the situation for GBV and women in general and gender at 3 stages. First, they specify the barriers of women in front of women and girls. Assessment of result, for example, this is coding, including lack of door locks, adequate lighting, lack of gender segregated facilities, long distance facilities. As you see, here is a very clear barriers. Instead of saying that they are facing physical barriers, they said that it's including lack of door locks, for example, and so on. Then they highlighted who is the most vulnerable according to access to WASH items. They highlighted that, for example, IDP and returnee female headed household are more vulnerable compared to other female. They highlighted the affordability problem, as we see. Also, they highlighted what is exactly the problem, for example, hygiene items. Then they highlighted also in their analysis what is the capacity of WASH actors and GBV risk mitigation. They go through and discuss how there are a continuous effort required from WASH staff to train on basic GBV concept and referral pathway. So this is a clear analysis about who is affected, what kind of barriers in front of him in clear way, who is the most vulnerable among the groups, and then what kind of action or capacity existing now in the local situation in order to confront these barriers. Next, please. For example, in disability, there was a different in Afghanistan in HNO 2020. We have Afghanistan have done, and this is an example regarding how we organize our work. Afghanistan, for example, have decided to have a subsection about disability and mental health. And in this subsection, they have a critical problem analysis to some extent to identify, quantify the analysis of factor contributing to risk for persons with disability and their family. This sometimes help when you have a specific subsection to disability or GBV or accountability. This will help you to highlight the problem. The analysis also of data sometimes is very helpful. For example, in Afghanistan, they use the secondary data analysis. Afghanistan Reach Protection Assessment have done 2018, and they have to understand, for example, women had significantly less access to WASH facility if living in household headed by someone with disability. So they are able to have analytical insight on that. Also about for example, in CAR, they have used HI pilot Handicap International or Humanitarian Inclusion Pilot Survey in 2019 also to understand which secondary data, how much person with disability experience discrimination accessing health service, for example. Next, please. So we will have a small Mentimeter again. In the same, thank you, Masumi, for sending the link. You can access it either by having enter Menti and enter the code 3644327, or you just go to the chat and enter the Menti link that have been sent. Thank you, Masumi. If you open the question for voting, please. So it's just to understand who is still with us and who just, so I'm with you and interested, I'm with you, but losing my focus, I'm lost, need a break. So we have 12 interested in the webinar so far. Thank you. Great.
So that's very good news to see that because yes, it's a lot of information, but obviously very important. So I'm glad to see the results. But this poll was Indeed, to give you a bit of a break, I also take this opportunity to remind everyone, please, write any question or comment in the Q&A box. There is one. We'll go back to this later. And if you just want to keep your questions for asking it later directly, of course, by all means as well, but there will be space later. So I'll let you carry on the voting.
Just close the voting.
And I think, Ahmed, you have a few more slides, right? Before handing back to Masui.
Hi. Sorry. Yes. Common approach. Yes. Strategic planning. So what we actually, as we have done, when we finish the HNO, we should move to HRP, which is the strategic, most of the time is strategic planning. And as we said, one of the most important, if we have a strong HNO, we will be able to have a strong HRP when it's come to the situation of person with disabilities, the GBV, the AAP. So what is the common approach we advise when we are integrating cross-cutting issue in HRP? We need to understand that country level planning should be systematically participatory. The participation of all affected community group should be systemized inside the situation. They should be given an opportunity, all of them, to express their needs, their prioritization, and to which extent they are satisfied with the response. Also, we should include response strategy with addressed identified barriers and protection. When you have done the analysis, risk analysis and barriers analysis in the HNO, we usually, the more that we have a clear analysis, the more that we have more action to do, and to use that to build a strategy. For example, GBV2 services, consultation with boys, girls, and those with disability, including monitoring of safe access and to use service facility feedback mechanism, all that of safety and inclusion audit also. Also, we need to include the strategy for strengthening the institutional capacity of local actor in cluster response. And with COVID, this is more and more very important. We know that our ability to have a response at the field is much weaker with COVID, and we will need to ensure that the local actor have the enough capacity and the institutional capacity to do so, including women organization and person with disability organization. And the most important, if we cannot measure it, we cannot achieve it. Having sex, age, disability, disaggregated data, SCD, DDD, is very important, and including indicator related to access to service also will be very important. Next, please. So, what are the qualities of a strong cluster sector response plan? And where and how we can integrate safety lens and the twin track approach. Let me know, Masumi, when we can shift.
Yep.
The cluster objective, and which is the main part and the first part, should emphasize the safety, access, inclusiveness, affordability, acceptability, and quality and dignified. And I think there are some questions about that in the chat. We will back in the question about how we can balance all this in our cluster objective. Also the BIN, the people in need, at very minimum, age and sex and disability segregated data is very important, and our cluster and sector response plan. Priority action, when we design our priority action, we should consider do no harm, reduce the response and of course reduce the BV risk, and address the special need of persons with disability and women and girls, and mainstream them in all action is very important. So either specific action to reduce the risk or specific action to include the person with disability and the other group inside the action is very important. This should be translated in the activity. It's because we have seen that also last year during the HRP and HRP review. Sometimes we have a strategic goal, priority action, but when it comes to activity, there are no corresponding activity to this priority action. How we should engage women and girls and persons with disability in every activity, not only the activities that related to them. Address the barrier that we have identified and the critical needs. This is very also important. This should not be standing in activities. The funding and monitoring also should be included. A budget for GBV risk mitigation, disability inclusion, according to the planned activity. And also we should monitoring, as we said, all our activity to ensure that all indicator have disaggregated data in general indicator, and we have some the indicators that is covering this area. Next. For example, also we should follow the twin track, what we called it a twin track approach. And twin track approach are used to identify and link how we are, the analysis that we have done in HNO will be translated to real response in HRP at two track. First track is mainstreaming and second track is targeting. The mainstreaming, I will just give an example here. I will not go in details. For example, if in our critical problem in HNO, we discover that women with disability facing a heightened risk of GBV due to information about GBV prevention. They cannot access to the information that is related to GBV prevention. So in this case, we should found in response option development of GBV prevention and response information in multiple and accessible format, which is the same prevention and response information, but we will do it more accessible, which is meaning mainstreaming. But sometimes we need a target activity. For example, if we discover in HNO that we have girls with disability are out of school due to limited capacity of teacher to meet their learning requirement, the teacher is not trained to deal with girls with disability, we will add a specific activity, for example, or risk or response option to training of teacher on inclusive education, which is targeting in inclusive education or targeting to disability training. So sometime we will need to ensure that disability, gender, and accountability is integrated in all our work. And other time we will need to develop a specific and target group that is activities that is targeting a specific group that we are aim to target. Next, please.
Okay.
Okay, thank you, Masumi. Thank you.
So then from here, so we do have a lot of good examples. So we just pick a few, but there's a lot, and we will share with you our review when we send everything. For example, there is our highlights monitoring of GBV awareness and prevention activities and promoting dissemination of information, etc. But with really are focusing on the women and persons with disability. Again, as we kept telling that there are different barriers for, again, different people to access to information itself. So really need kind of deliberate our efforts to make sure that they are available. All of the population group, especially the vulnerable one that we are working, have our access to services. And also some countries include the accountability mechanism needs to include persons with disabilities, so different disabilities, and they can access to the compliance and a feedback mechanism, because if we don't consider their needs, it won't be accessible. And also are a lot of countries including the safety audit. That can be like a wash safety audit or nutrition safety audit or the multi-sectoral safety audit in the countries like in Somalia or in Nigeria. And a lot of countries included training of frontline workers on GBV referral pathways, but also are different training for AAPs and disabilities as well. And also are building capacity, sorry, this is actually the organization of persons with disabilities or capacity building of the local women's organization. So there are already good response strategies included in many of HRP, and really the challenges that we have seen in analysis is really as soon as you find the risks and the barriers in actionable way, so not the financial format, but user fees, then it's easier for you to come back with a response strategy. So nothing special basically for or compare with others So you need to just know the actionable level of data. So some of these indicators, there are also indicators that's coming. These are also examples from different HRPs. So for example, barriers and risk analysis. For example, this is quite popular indicators, number of a safety audit or monitoring conducted, or the number of people used, accessed, but disaggregated by sex and age and a disability. Because if we do not know who is not accessing services, we don't know, I mean, we can't even know like which barrier we should analyze and what measures we should do. So basic things like that can help. Or the other popular thing is that percent of gender segregated wash facilities, or percent of inclusive or accessible wash facility. These are some of these indicators that you're already using in your response, but can be really helpful to understand cross-cutting issues. So other example could be a capacity of frontline workers. And third is also participations and perception of services. For example, our number or percent of community members reporting improved safety and a comfort of accessing services. We have seen it in WASH, nutrition, actually education, many, I think, clusters, many clusters have already included some kind of indicators related to the participations and their feedback. But a really important thing is that we've been kept telling, but really disaggregate data as much as possible by at least gender, age, and disability, so that we know who is not accessing, who is accessing, and then we can add more info, we can collect more information, why they're not addressing, so that we can address this barrier. So it's very simple. And there's most of the indicators you have already have are this kind of aspects. So I'll give you also two good examples. One example is South Sudan WASH. So South Sudan WASH has been actually integrating for GBB risk mitigation very well. And they have, for example, included the specific objective for GBB risk mitigations, and also specific indicators for GBB risk mitigation. For example, number of women and girls with safe water and access in secure locations. So these are this is like ideal that you have the specific objective and a specific response strategies and specific indicators. But I mean, even though you couldn't go this level, at least to have our specific response strategy to address the barriers and risks, and then have corresponding indicator that would really strengthen your response. And also another example is that when you do the HNO, you might find some information gap. So you could also include some activity to address information gap in HRP. So the other one is the Somalia HRP. This is for disabilities. So our Somalia team increased efforts to identify barriers, risks, and enablers for people with disabilities. It's great that they have also the enabler and strengthen the inclusion of people with different types of disability. So not just like physical disability that we can think oftentimes. And for that, they added additional resources, and then they also have done the data collections and included and build also strengthen partnership and the capacity of the organization of persons with disabilities. And then that's also improved monitoring, reporting, and learning. And all projects under the HRP to have identified the disability considerations. So again, Somalia is very kind of comprehensive. It's not just using one data, but having made efforts and work with local organization of persons with disability and really improve the monitoring. So this is a very good example that can be used for different cross-cutting issues. Just for our resource mobilization, finally, again, we have seen a lot of improvement in HNO and HRP, but the big gap that we have seen is the funding allocations. So, if there is no money, nothing would happen. So really include adequate, so common approach, we really are suggesting include adequate budget for the AAP, disability, and GBB risk mitigation and integration. For example, you see that we will make inclusive, for example, facility, but if there is no funding for the inclusive facility, it will not happen. So also include a cross-cutting issue in the fund allocation strategy when cluster makes it. and also prioritize local actors for funding allocations so that they can really access to the funding and they can access to services and they can provide us better information later. So some examples. This is example from Palestine last year. So they have put cross-cutting issue into the project vetting guidance and the checklist. So this is just our excerpt, but you can see there is our specific issue on gender mainstreaming, protection mainstreaming, community engagement, and local partnership. So it really kind of encourage all the partners to include the cross-cutting issues, and those who made effort in analysis and the response strategy is prioritized to receive funding. So this is a very simple but good practice. And again, so South Sudan WASH, because they have objectives as well, they have also included GBB risk mitigation is one of their funding strategies. So this is the humanitarian funding, National South Sudan Humanitarian Funding 2018. But again, having that specific fund allocation in the cluster strategy really makes it strong and also makes encourage partners to do more like inclusions of cross-cutting issue at analysis and the response part, and they would have also more opportunity to access funding. So yeah, now over to you, Charles Antoine.
Thank you very much, Masumi. What I suggest we do, because we have another poll which is focusing more in terms of looking forward and technical support as well. So maybe because we've got quite enough time, which is great, maybe I suggest we open the poll first. That will give everyone a bit of time to breathe and reflect, and then we can open the Q&A soon after. Is that all right?
Okay.
So I'm sure everyone is getting used to that. And then feel free to type any additional question you have or just indicate if you want to speak. We will open the discussion very soon, but let's do the poll first.
So just to explain, we have done the current practice, but we wanted to see based on this webinar, what do you want to strengthen? So some of you have said you have already worked with vulnerable populations, but do you want to strengthen? Or, so this is more like for future after the webinar, what do you want to do? What do you want to strengthen more? It's amazing. Already we can see our more interest than the beginning of current practice.
I was going to say, indeed. Let's give it a few more seconds. Okay. So indeed, very clear indication that there's a lot of interest in strengthening these different aspects. I guess the question now is how and what kind of support is required, which takes us to the next. Similar question for HRP. Okay, I think there is a bit of a consensus there on these different questions. Should we close the poll? So the next question is on technical support. There's a big competition going on between the first two. I will really encourage everyone to vote on this, because that's also, it's not just to get a sense of what colleagues feel and need, but that will also, to a large extent, help us shape the type of support we provide through the clusters and through technical specialists, etc. So I think please log in if you haven't done so and vote, but you can also obviously comment on the chat box or ask questions. I think for me that's an important part of the webinar as well, in terms of unpacking what will be required as next steps and technical support. Okay, I think we can probably, good idea, Masumi. Let's keep this open. And and take your time to vote. We can go back to this as part of the discussion. So let's move on now to the questions and comments as well. Once again, please type your questions in the Q&A box. We've been also monitoring the chat box. If that's okay with everyone, I think that's nicer if I call upon those who ask a question and they can just re-ask the question or make their comments directly. It's a little bit more lively. And then again, jump in, raise your hand and jump in if you have additional points you want to cover. I think the first one was from Madi, talking about whether there is a disability inclusion and AAP framework. Do you want to maybe just give a little bit of background to your question, and we will address this one. Madi Abdullah, yes, go ahead.
For me. It's okay for me. Just I am wondering whether is there any general framework for accountability, inclusion, and protection to be used by all clusters, or each cluster has its own framework. That was my doubt, and you can reply anytime you want, whether by email or now is okay for me. Thank you.
I think, yes, thank you. Thank you. I'm sorry to put you on the spot like that, but I think that's a very relevant question, and that's something we've been discussing. I'll invite maybe my colleagues, Ahmed and Masumi, to jump in as well. We've had discussions on this. I think the intention when we try to bring these cross-cutting issues together is definitely to simplify your work, and also, I'm not sure we can call what we've been presenting a framework as such, but it's going in a similar direction. But please, Masumi and Ahmed, jump in if you want to add anything on this point.
Thank you, Charles. Thank you, Mahdi, for your question. I think this is a very interesting question and very important one. Very fast, actually, we have a pyramid of actually framework, policy, and guideline regarding inclusion of persons with disability. We have the Charter of Inclusion of Persons with Disability in Humanitarian Action, and we have IASCC guideline for inclusion of persons with disability in humanitarian action. And lastly, which is actually what you should use in your clusters, and also the country team should use in HNO HRP, the guidance of strengthening disability inclusion in humanitarian response plans that have been issued last year. I think this is one of the most comprehensive guidelines you will see. The 3 documents that I talked about, you will find it in the end of the slide in the resource package that we will send. Thank you.
Thank you, Ahmed. Masumi, I don't know if you want to add anything to that.
No, nothing to add. Okay,
thanks. Now, there are some questions coming in the Q&A box, which is great. There were also a number of questions which do not need to be answered more in terms of the availability of the PowerPoint, whether that will be made available to implementing partners, etc. So our intention is definitely to make it available, and I think we should include implementing partners. So let's make sure that's the case, and that anyone working with the clusters can access to this information. Now, monitoring the Q&A box, let's start going through these questions. So there was a first question, which is actually from, sorry, Madi, your question was also there, so we've addressed this. There's a question from Pierre Faucassier. Could you please remind us where to find simple BA tools?
Sorry.
Pierre, maybe if you want to elaborate, excuse my ignorance, maybe that's a silly thing to say, but I'm not sure what you mean by BA tools, so maybe you can jump in.
Yes, good afternoon. Can you hear me?
Yes, we can.
Yeah, so I had a few questions. One is, the different tools mentioned. So BA is the bottleneck analysis. for all the barrier analysis for the different vulnerabilities and for women and violence and also disabled people. So I think I had someone replied, this will be provided. So my second question is, if you share with us a folder with all the tools, it will be great that you provide access to our IPs, implementing partners as well. So basically, when we write with them our contractor PCAs, we can include the link to the different tools we would like them to use during their program projects. And the last question was regarding the Menti. The last question, so it's a difficult one, is thank you. You shared with us a lot of good process tools for planning, designing, etc. But the most important is really to look at the, as you agree, is to look at the results and to match what we committed in the documents, to match it with the actual services or support provided to this vulnerable. So again, I think it's really important to include as well some evaluations and evaluation tools as well to get the voice of the people affected, and to after our response through our partners to make sure that their needs and their preferences were included in the response, and also to help us for the next one. Over.
Thanks very much for that, Pierre. Very good points. Maybe if I may, on the access to information, we actually, as part of the AAP unit, we're developing a handbook for UNICEF and partners as well, and we have a number of tools being developed. And what we plan to do very shortly is to put it on the page that the Core Commitment for Children revised CCCs basically is planning to have, and we'll have a space there. And that's maybe something we can explore. I'm not sure, Masumi or Ahmed, if you've been looking into this already, but that could be something practical, so that the page is accessible to UNICEF implementing partners. So I guess that's something we can look into. Any of my colleagues want to respond to some of these other points?
Yes, Charles-Antoine, thank you so much, Pierre. So we have also put the made a compendium of all the tools from AAP, disability, GBV, risk mitigation, and localization. It's just the links. So with all these essential tools, so we will send that along with these presentations and other things. So you have only just a 2.5 page documents that has all the tools. So it might be easier for everyone to access, and the links are outside. So regardless of their organization, they can access all the tools and resources. And then Pierre, also, I cannot agree more to really we focus more on evaluations and how the affected populations think about process. So we also have some kind of discussions at the clusters. So please do also share your opinions. We will share this opinion, but we will also, please do share your thoughts to also cluster help desks and so on, so that people, we can understand there are huge needs, but really can't agree more.
Thanks, Masumi. Yes, I fully back this up. And I think that's probably also part of this question, the last question we asked in terms of technical support. There was one which was about sharing good practices, which is one way to document the sort of concrete work we're doing, and not just around the HNO HRP. So it's something we should definitely explore and keep in mind. In terms of some other questions, Charlie, welcome to the webinar, first of all. And I don't know if you want to go through your question, or shall I read it out?
Hi, yeah, it was just, that was very interesting, thank you. I was just interested in learning more about how you measure the capacities of local organizations or even clusters, I think you mentioned, to either mitigate the risk or promote the disability inclusion, protection and AAP efforts. Thank you.
Thanks for the question. I would invite participants as well to share any good practice they might have, or anything that contributes to the answer. I don't think we should pretend to have all the answers. But first of all, I mean, anyone please jump in if you have any example to answer this question. Otherwise, I don't know, Ahmed, Asumi as well, if you have any answer. I think we've been, maybe I can just say on AAP, we've been looking at the cluster performance measurement on integrating AAP question as part of the CCPM and these similar processes. So I guess that would be the obvious entry point. I'm less sure about localization, but I guess similar approach could be used. But please jump in.
Yes, thank you, Charlotte, for your question. It's a very important question. Actually, you will find some resources directly in localization. Resources that will be sent also in the package of, but it's very important also to understand that it's when we talk about local organization, we are talking about two types of organization. We are talking about representative organization, specifically in disability, which is person with disability organization that is could, yes, provide some services, could integrate in the inclusion, but they are more support us to reach to person with disability, having represent person with disability in the discussion and the group, which is also, I want to highlight that also in participating and the consultation with person with disability directly is very also important, but sometimes we are working directly with their representative organization. And then we have a local organization that is working by providing specifically service in disability or just providing services in general. And this is the most important one that we should measure disability inclusion, because if we have an organization, for example, that is working, providing like wash services or other type of services at local level, and we are working with them to provide the services, we need to ensure that their work is inclusive. And this will not be happen if we don't have an actually inclusive plan, HRP plan. And then there are several tools to measure the disability inclusiveness at program level and at action level, and then at organizational level also. Thank you. Masumi, do you have an added on?
Yeah, so for Nigeria, they have done I think 2 years ago, the GBB kind of it was educations, and maybe other clusters as well, has also done the evaluate their current practice on GBB risk mitigation. So, I mean, we can also share that if we can, we can include the link into the compendium so that you can see other example. But as Charles Antoine said, that if you have any examples like this, or please share with us so that we can kind of keep updating our resource, our compendium, so that everyone can access to the good practices and tools are used in countries.
Thank you, Masumi. And yes, I was asking if we are planning to review HNO HRPs 2021. I do believe that this is the plan, but again, I'm looking at my colleagues to confirm that. I think that's been a very, at least as far as I'm concerned, a very useful exercise, and to be able to compare and track progress to some extent as well. I think that's important to keep looking at that. Obviously, it takes time and resources, but that's something which I think we should be continuing. Am I right in saying that, or making a commitment which you may disagree with? But maybe I think we could take the opportunity of this webinar to say we will at least try hard to continue this work, right?
Yes, so there is a plan that we will also review HNO HRP, and there's also another plan that by request from I think regional office and country offices, that we maybe make our quality checklist so that we know what's that everyone know what we are looking at for HNO and HRP. But yeah, I agree, Charles Antoine. Let's use this opportunity to make it more systematic.
Now, there are a few more questions. Let's maybe while you may add questions in the chat box or the Q&A box, maybe we go back for 1 minute to the poll, if that's all right, Masumi, and see where we are and if there have been more answers to the last question. Again, that's going to help us shape the kind of support we provide. Thanks. So we have a majority of participants who have responded, which is great. So definitely interest for needs analysis, interpretation, support from AP disability, GBV risk mitigation, and then quite strong support for examples of good response plans and indicators for cross-cutting issues. I don't think we shouldn't dismiss any of that, and we should be aware that some colleagues may have been unable to participate and may have different views, etc. But that gives a good indication for us in terms of where the priorities should be. Is there anyone wants to comment on that? My co-facilitators or any participant? Just raise your hand. I don't think you can unmute if I'm not mistaken, so it's not easy to keep suggesting you should jump in. Actually, I realize I think the technology doesn't allow that, but raise your hand if you want to comment. And colleagues, I don't know if you want to. Pierre, okay, please, let's make sure you are unmuted.
Yes, can you hear me?
Yes.
Yeah, maybe in terms of technical support, what I don't see here is the response analysis itself. That is for the sector or for UNICEF, analyzing the different aspects of the response and trying to match it with the needs identified for the vulnerable people, and also to match the proposed activities or the chain between the activities and the result, and to match it with the needs of the most vulnerable. So this is the response analysis. Over.
Okay, well noted, and I think it talks to your earlier point as well. And definitely something I couldn't agree more, because I think that we've seen that when we've been looking. I'm talking more from the AP perspective, but I'm sure that's valid for any cross-cutting issue. And I've seen that myself in various field visits and so on. It's not because you have all the right language in HNOS, HRPs, etc., that the response and the practices will necessarily follow, and then there are obviously additional questions around resources and capacity and so on. So I think we should definitely keep that in mind, and make sure that the support is not just about HNO HRPs, which are obviously important, and that's the kind of season right now for that, but goes behind. So I don't think anyone would disagree with that. Any other quick reaction to that?
There's one hand from Wendy.
Yes, can we, do we need to unmute you?
He should be able to speak now.
Okay, well, great.
Disappears. Oh, he disappears, so maybe.
Okay. Another hand.
Yes.
Suleiman, I can see.
And he should be able to speak now.
Great. Suleiman, do you want to jump in? We have Koki and Suleiman, so you should be unmuted.
Oh,
yes, we can hear you. Go ahead.
so this is not actually Koki. This is Isaac.
Okay, but that's fine. Go ahead still.
I had a challenge because I registered yesterday, and unfortunately, I was looking for a link and I couldn't get it. So I asked Koki to send me. So if it is seen as Koki, but I think this is Isaac. I had one comment which I had made related to maybe some of the AEP protection GBV note, maybe very much featuring into some of the HNO and the HRP. I think my experience, I'm actually working from Yemen as a nutrition cluster coordinator. I think one of the main challenges about the format or the templates which are being used for a HRP, HNO, while there may be some kind of common understanding in terms of the main topics or areas to be covered, but I think the final kind of innovations and of the HRP, HNO sometimes actually is decided by the HC, and he may try to reorganize the HNO, HRP, depending on how it is maybe more appealing. So as I was just giving an example, but for example, I think in the Yemeni context, I understand that there's one topic, one chapter specifically talking about protection, and which in most of the time maybe cuts across all the other issues. So I was suggesting, I think that maybe if I was leading.
Sorry, you're cutting off. We can't really hear.
Kind of strictness of adhering to the format. That's one. Secondly, I think the other reason is also maybe the cultural sensitivities on some of these terms. GBV, and the protection in Yemen is very, very sensitive. I understand. I think there were some texts which we had put related to protection, related to GBV, but the authorities, asked us, please remove them. We don't see these things happening in Yemen. So those are some of the things that sometimes when maybe we are going through some of the HNO, HRP, and particularly if you are trying to check on nutrition, you may not see some of these things coming up conspicuously because there's such kind of sources in the authorities here on some of those kind of gender protection, AAP not very much, but in particular gender and the protection. Over to you.
Thanks for that. Two excellent points. I think Masumi wanted to respond.
Yeah, definitely. Thank you so much, Isaac, for amazing comments. So I think a template, this year's, global template we can't influence, but I think it'd be great if cluster coordinator, especially UNICEF has 4, can maybe push the better inclusions, as you mentioned, but also this is also learning process for us. Maybe this year, with all this your experiences, we can really do the evidence-based advocacy for next year for better template to include cross-cutting issue, as you mentioned, because that would be really helpful. So for GBB inclusion, absolutely, that's a challenge in many countries, and that's why I think we don't need to use maybe word for GBB, but really what we are looking at is the specific, for example, risks or safety concerns for women, especially for women and girls for accessing services, or what are their specific needs. So when we maybe unpack it to what we are actually asking, it's really the barriers and risks and the special kind of needs of for GBB to come, women and girls, and also I think that's maybe our easier way to include. So GBB risk mitigation can be our kind of a good way to integrate the protection issue, but without really raising the concerns on just saying GBB or protection, because that's we understand. So again, happy to discuss more if you want to brainstorm in Yemen in such a difficult context. Thanks.
Thanks,
Thank you very
Masumi.
much. Thank you very much, Masumi. I think that's a very good, way. As you mentioned, I think yes, the only way is to try to, you can try to hide it, not to bring it very much conspicuously, because the moment you bring it, because the HNOS, you have to engage the authorities, it has to be, open for discussion. It goes through a number of processes. And they are very much keen in pointing out some of the very, very, sensitive kind of, statements or within the HRP, HNO. Yes, so I agree with you. Maybe trying to cushion it in a way that it doesn't come very strongly. Someone can pick it immediately, but maybe focusing on some special groups. But they're also very, very sensitive. I don't know. It's very difficult, to be frank, but I think we can chat, bilaterally later, maybe, this week or next week. Thank you very much. I think this training was very, very useful with all those good examples which you have given. We would have those examples also coming from Yemen, but unfortunately, as I told you, we tried and it couldn't work. Thank you.
Yes, you're welcome. I can see that Suleiman still has his hand raised. So, Masumi, do you mind unmuting him?
Sorry, this was in error.
Okay, no worries. But you're still welcome to intervene if you want. Otherwise, we'll go back to the Q&A list.
Thank you.
No worries at all. Okay. I mean, if others want to comment, I don't need to repeat myself, you know what to do. We still have one open question. It's pretty straightforward. I don't think I'll ask Francois to read it, but Francois is asking, are all the HCs aware that an HNO should consider the social barriers and coping mechanisms, a paradigm shift? I like this term. I think that's pretty appropriate in this case. I'm not sure. I don't know if that's a question that needs to be answered. I think Masumi wants to jump in, which is great. My guess is probably not, but it's up to us to raise awareness on that. I would also invite colleagues, because I think that's an important point. It's all well and good to have the guidance and tools and being aware of the importance of that. But with the risk of going back to a fairly basic way to assess needs and not pay sufficient consideration for these aspects is really there. So any experience of either very strong HCs will really understand that and support that, or the opposite from any of you would be useful. But please, Masumi, you wanted to give some elements of answer there. Go ahead.
Great, thank you so much. So the barrier analysis and coping mechanism is part of the GF, so it should be already included. But again, it's a very good point, because HCs also should understand very well on importance of including other things, and then really not just having barrier analysis by refugees, IDPs, but really are disaggregated by age, sex, disability at minimum. And there are a few HCs that has made a strong commitment. For example, Somalia or Nigeria, I know, and that's really made a difference, made a really a huge impact. So I think it's really a great suggestion, and maybe this is something we can also think as a collective advocacy. But yeah, as Charles Antoine said, it'd be good to hear more example from other countries.
So if you have some examples, or if you want to just talk us through your particular experience with this, obviously we have time and we'd be very interested. Maybe write in the chat box first. What I think we can do now is to talk you through very briefly, at least show you some of the resources we have. We have just a few slides for that. That may also trigger some additional questions, but let's do that now. There won't be much talk, but it's really for you to be able to see. So that's all of that has been put together in the compendium that Masumi mentioned, but we still felt that's important to give you an idea of those resources available. So no need to talk through this. I think you can see what they are. And thanks, Masumi, for your comments. There was actually this question about audit, so thanks for adding this in the chat box. I think there are a few more slides. And the list of resources for AP as well. And now that's the different help desk. I'm sure you're all very familiar with this as well. I just wanted to add something which may be of interest to you, and I think in the near future, once this is available, we can share with this group. As UNICEF, we also co-chairing the IAC results group on accountability and inclusion. And in this context, we've been basically sort of not developing as such, because there used to be a help desk a few years back on AAP and PSCA, but we are kind of revamping a help desk for accountability and inclusion, which we very hopeful that it will be obviously useful and underused across the board. So something we can share some information on as well. But obviously for questions within UNICEF-led clusters and AOR, we use the dedicated help desk, which each developed, and then any question on cross-cutting issue would be forwarded to the relevant person. So that's the way it works. Is there any comment or question in relation to other resources or help desk? Again, that's one of the areas when we talked about technical support that are the obvious ones in terms of providing the support. Something we haven't talked much about is peer-to-peer support. I hate to look at these things only as global level support to countries. I think there's a lot to learn amongst practitioners and colleagues. So again, any good practice or example there would be useful. Are we over time, Masumi? I'm not doing my job very well. Yes, we are. Okay, sorry, that's my fault. I don't know why I thought we were finishing a little bit later. So let's wrap up. I'm really sorry about that. I thought we had more time. But thanks to everyone for your participation. As we said, we'll share the resources and keep the discussion going. I think there's been a very range of very good points in terms of moving forwards, making sure that we continue the HNOS-HRP analysis, share resources, make sure that we continue sharing lessons as well, and also not focus only on process, but also the program and service provision part of things. Some good questions on templates and formats. Again, we can follow through that and see how much we can influence the HNOS-HRP processes. And some points on the advocacy and the need to make sure that it's not just technical, perceived as technical work, but also ensuring the leadership engagement, HCs in particular. I won't say much more. Sorry again for running over time. Thanks for my colleagues, Masumi and Ahmed, and thanks to everyone for participating.
Thank you very much.
And maybe we send the evaluation offline, Masumi?
Sure, so I can send everyone the RF. Yeah.
Excellent.
Yeah.
Great.
Thank you, bye.
Thanks, bye-bye.
Bye.